So I made a video answering an anonymous question, um, but when I went back over it, I wasn't happy with it for a few reasons. And it's been a while since I've seen any doctors or anything, so I just kind of refreshed myself with some of the facts. So I'm redoing it um, to make sure that I spread the appropriate knowledge. So here we go. Anonymous asked, um, what exactly does the disease that I have do to me, and what could it do to a potential partner? Well, hepatitis C actually is not an STD, but it can be transmitted sexually, and that's kind of awkward um, for a few reasons. Um, because if it's not officially an STD, how come you can get it sexually? Well, that's basically because um, hepatitis C is blood to blood contact strictly, so the only way that it would show up sexually is if blood ended up in the semen or sperm or whatever during sex. And that is possible and it does happen. But then, even then, um, it would have to somehow enter the partner's body um, and get into their bloodstream. And it takes a certain amount of blood to actually accomplish this, anyways. So it's unlikely, but it is somewhat of a risk, I guess you could say. But as far as how the disease actually works, it basically goes like this, and this is just basic. It basically thrives in the blood, so that means all of the cells are contained in the blood, um, and so it travels through your bloodstream and whatnot. And every disease has its own function um, or task that it carries out, and it causes and does different things. Hepatitis C attacks the liver, so basically your liver filters blood, and hepatitis C is in the blood, so it's constantly getting an opportunity to attack the liver. Now there's two different types of, I guess you could say, levels of illness when it comes to hepatitis C. There's the acute form and the chronic form. The acute form is very short going, usually within 6 months of contracting it. Usually it will destroy the liver, and basically your options then are to get a liver transplant or die, which is terrible. Yeah, they can't even, at that point, I wouldn't think that they would be able to give you the typical treatment they have. It's not a cure, but they do have a treatment that is sometimes effective on certain percentages to decrease the viral count down to zero, which still technically doesn't declare you as cured because it can come back or you can contract it. So if theoretically, if someone did give it to their partner, two things could happen. One, obviously, well, it's not obvious. It is obvious to me because I've known about it for a long time. But um, usually with diseases like that, it usually takes about 6 months or so before it even shows up in your system or before it will show up on a test. I think they can do a blood work and get a test. I don't know if that's true or not. I don't really feel like researching it, but theoretically, if I did give it to someone, or someone who has it other than me also gives it to someone, they would basically be looking at either contracting it into the acute form or the chronic form. Um, and I think the percentage of people who contract it, not from birth but from blood to blood contact, I think it's about a 75 to 85% chance that it will become chronic as opposed to acute. So it's rare that someone gets it and then pretty much just dies and falls off the face of the planet. So most commonly it's the chronic form. And if I'm not mistaken, I think the statistic is still pretty much the same. About 3.5 million people in the U.S. have it, or it's estimated. Um, it's a rough estimate, mostly, like I said, because they don't even know. A lot of people don't know that they have it, and they could have it for 20, 30 years and not even know before they show signs or symptoms. It really just depends. Um, I guess I was kind of lucky that I know that I have it, but at the same time, it's kind of really a mental drag, um, to be perfectly honest. But I guess it's better to know, that way you can monitor, even though I haven't done that because I have crappy insurance. Um, I wish I lived in Canada or England or something. That'd be nice. Um, but there's also downfalls to that too, I guess. Wherever you go, there's problems. But anyways, It's basically the gist of that. The other part of the question was, would I talk about experiences in foster care? Sure. Um, for me, it was mostly normal. A lot of people think, oh, it's terrible. And I mean, it was terrible, but for me, it was normal. I mean, I know it wasn't normal, but it seemed normal. I mean, I didn't know any different. It was, in that sense, it was normal. Um, but it was a horrible experience. I myself was in approximately 15 or 16 different homes in the span of 19 years. There was more, I think, than actually that I don't know about because I was so young, because I was in at birth and I don't know a lot of the homes that I was in. A lot of kids, people say, oh, that's awful, that's terrible, but surprisingly, there's a lot of kids in foster care who actually have been in multiple homes, like way more than that, 25, 30, and it's really insane. So I actually got lucky in that sense that it was so little. But further into it, you move from home to home, you're constantly in fear of, if I don't do good in school, my foster parent's going to kick me out and they're going to send me to a different home, or my social worker is going to threaten to move me. Um, if I don't do this, or if I don't comply with this, or if I don't do this, then they always threaten with the fear of moving. The other thing that usually tries to happen in foster care, they usually try to basically force you on a medication. They kind of force you to see a psychiatrist or a therapist, and ultimately they find something that they can pretend that's wrong with you, most commonly ADD or ADHD. Um, and then it expands from there to depression and other things, and then they just try to throw you on a cocktail of medication and basically just turn you into a zombie, which I was there, and um, I personally have my own opinions of it based on myself, and I know everyone's different, but I have my own opinions on that matter. But um, further than those things, I actually had a failed adoption, which was one of the most hurtful things in my life, and I've had a lot, but that ranks up there. I was supposed to be adopted by these people who were from England. They were from England, but they lived here for a long time, and I actually moved with them. I knew them for 4 years while I was still in foster care because they lived down the street from my foster house. But when I moved with them, they moved to Texas, and I lived in Texas for about a year and a half with them. Didn't work out for them, and they decided that they had enough, and I actually had to go back to California. I'll go into detail if anyone wants through text on that. I really don't want to get into it. The details of why it didn't work out. I'll be happy to through text or something like that. It's just kind of a long story. But it didn't work out, so I had to go back to California. And keep in mind, during this whole time, I was still technically in foster care, because I was never officially adopted. So a lot of people think, oh, well, you were getting adopted, you weren't in foster care, and I was, no, I was basically in the system. I mean, I even lived with family members during the course of my, I guess, life. Sorry, I'm having trouble putting thoughts together, but through the course of my life, I lived with family members, and I was still technically in foster care, because they weren't, even though they were legal guardians, that I was still in the system, and that I was still monitored with social workers and whatnot. So there was that, and then my mom died when I was 14, and I never met her. And then you guys probably see that I post a lot about that, but that kills me more than everything else, and that's not even technically related to foster care, other than the fact that she was never there for me. But that one really hits home for me. Gosh, what else is there? I mean, I've lived in homes with people in gangs, all different races, nice people, mean people, just craziness. I mean, people often say, like, can't even comprehend that. They couldn't even imagine. But for me, it was just kind of normal. Like, like I have to get along with these people because I live with them, and you get along the best that you can. It's kind of like, it's not your typical family. It's it's just weird, but for me, it was kind of normal. Like I said, I really don't know how to explain it any other way, other than that. But those are some of my experiences. I can't really think of anything else off the top of my head. I'm probably missing a few important ones, but a lot of abuse, neglect, loneliness, you name it. There was a lot of it. And it eventually did take a toll on me, but not until my senior year of high school is when it really sunk in. Just growing up, you didn't really think about it much. But as you get older and you realize where life is supposed to be, and you see everyone around you and where their life is actually going, and then you realize your life is totally different, and it kind of hits you, and it did. And I kind of went through a really bad part of my life there during my senior year of high school. It was the lowest point I've ever had in my life, actually. And it wasn't just the whole foster care thing. It had a lot to do with my mom. I never really grieved over her death, and that finally caught up with me several years later during senior year, and that was really rough for me. So I relate to a lot of you guys out there when you talk about depression and all that stuff. I'm very familiar with a wide variety of different things, and I'm always here for advice or just someone to talk to if you ever want to talk to about that stuff. A lot of people are afraid to talk to me, whatever. Don't be. Totally okay with it. You're not bothering me. I know that I say I work a lot, but I have an iPhone and I always get alerts and messages and whatnot. So I see it usually immediately, but I can't always respond right away. But I'll always get back to everybody. So I think I've answered both those questions. If you guys are confused about anything, if I forgot anything, I'm still very tired. I know I said that earlier, but if I left anything out or something didn't make sense or I wasn't being smart or I don't know, whatever, just let me know and I'll clear it up for you. Um, Feel free to send in any other questions or comments, and I'll reply to you the best that I can. So until the next video, thanks for watching.